Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by VillageMD, primary care physicians. Practice medicine the way you've always wanted. Data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of VillageMD. We have a great set of guests with us today. I'm so excited to talk about some new changes happening in the pharmacy world. I'd like to welcome Michael Adelberg from Fager Drinker. He's a partner there and someone that we've really come to rely on to give us, keep us up to date on things in DC as they change. Hi, Michael, how are you?
Good, Wendy. It's a pleasure getting a chance to speak with you again.
And also welcome to Adam Chesler. He's our Senior Vice President of Pharmacy here at VillageMD. Adam, welcome.
Hi again, Wendy.
I know you guys are so excited to talk about changes in regulation, our favorite things here, but I wanted to invite you both because we've been talking about transparency in a number of different places for the last couple of years. We've seen hospital transparency. We've also seen surprise billing. We know this is a big area of focus. And so what I wanted to ask you guys to talk about today is some of the changes coming along for drug costs. And I think just to set the stage and the context, drug costs are such a huge problem, that many of our patients are dealing with.
I'm always excited to talk, so I'll talk drug costs all day long. I think everybody knows that they're rising faster than the national inflation rate. We don't even need that bubble there. I could have just said drugs are expensive, and I think everybody would have said, yeah, they are. But I think the big challenge we're having right now is we're shifting all the burden over to the patient now. The patients are responsible for so much more in their healthcare plan. So drug costs used to go up and you said, oh, hey, it's still a $5 copay. I don't really care. But now that you have these out-of-pocket costs, it's really affecting you. And when I was practicing as a pharmacist, even though it was unfortunately long ago, and now I feel like when I tell that story, I'm old. But I remember all the time patients would come in and they were shocked at how expensive their medication is. And it continued to get more and more often. We're kind of out there, and if a patient doesn't get their meds, they're not going to get well. It's common sense.
Yeah, it's a big thing that our program at Village is based around is this medication adherence, which we know is so critical.
When your med bottle is as big as you, as it is in that picture, I mean, it's challenging.
Yes. And Michael, I know there's been a number of hearings and lots of probably bipartisan attention at this in DC. Is that what's happening?
Well, there certainly has been a lot of attention, whether it's bipartisan or not. It's tough for Congress to get things done these days.
Yeah.
Which is why a lot of the activity is happening from the executive agencies and through regulation rather than through law. And so what we'll be talking about today are regulatory initiatives rather than legislation.
Got it. Okay, so let's go ahead then and just talk about this change. Like everything in regulations in healthcare, it does have an acronym, RTBT, but my understanding of this is it's really just like a way for people to get better information about their cost of their drugs. So Michael, do you want to tell us what this is all about?
Yeah, happy to do it. And so the real-time benefit tool is a CMS term for a consumer tool that ingests the drug formulary information from a Medicare plan and in real time can tell a Medicare beneficiary and their prescriber what the lowest cost clinically effective drug is. So Adam's the pharmacist here. I'm sure he's going to have good thoughts on this. But in a drug class where there might be several drugs that might all do the job, this would allow the member, and assuming the member shares the information with the prescriber to see not only the cost of the drug they're prescribing, but also the cost of all the other clinically effective drugs that they could prescribe, and then drive people to the lower cost drug. The real-time benefit tool is being implemented in 2 stages. In the first stage, which is already in effect as of January 1st, a Medicare Advantage plan or a Part D plan must have this in place with one prescriber in their network. So basically, it's a pilot, it's an experiment to get the plans doing this. The meat of the program goes into effect January 1st of 2023, when the RTBT must be offered to all Medicare beneficiaries in an MA plan with a drug benefit or in a Part D plan. And importantly, those plans are also allowed to offer nominal value rewards to get their members using it and get them comfortable using it. Ultimately, they'll save money and hopefully use it on their own. But in that initial stage, the idea of actually offering a gift card or some other nominal value gift to get people using these things, and we'll be seeing this happening early next year.
I kind of wonder if they thought RTBT looked like R2D2, or am I the only person thinking
I
that?
thought about that too. But it's cool, but it's not that cool. But
No, I was gonna just add on to that. It's not only going to be the lowest cost drug. I think it's going to lead to that discussion where the provider can say, hey, this medication has shown slightly better efficacy. It's really up to you. Here's going to be your cost differences.
yeah.
I can't tell you how many times my family members have come to me and all of a sudden they hit the coverage gap and they're spending thousands of dollars out of their pocket because they had no idea that they were even going to get to that point. I feel like this is going to reduce a lot of that and really lead to some genuine conversations between providers and their patients to say, this is a decision you're going to have to make. This is the efficacy. This is going to be the cost. We can start you off on this lower cost med, or if you want to jump in and get the expensive one, it's going to cost you.
Yeah, I just think that would be such a change to be able to look at that. I mean, like all these transparency rules we'll see, but the idea that you can just look it up and go, okay, this would be the other. I mean, I don't even know if there's a place right now. I mean, we all Google, but do you go right now to even see your formulary?
Wendy, there's nowhere anybody can do it. I think it's so complicated and confusing right now. The number of patients that come to the pharmacy having no idea what they're going to pay when they show up is outstanding. And the amount of time that this is going to save providers from not having the pharmacy have to call to say this is too expensive for the patient, they can't afford it, and the clinical outcomes it's going to improve just because patients know what they're getting into when they show up at the pharmacy. They're going to show up, they know what it's going to cost, they'll pick up their med, they'll go home and take it and get well. Like we said, if you don't get your med, you're not going to get well in the first place.
So I wonder if this will work, I mean, like, is it going to be right? How hard? Because it's like such a major change. I wonder how accurate it'll be.
As
a non-attorney, I could answer, but I want to hear the attorney's answer.
So the RTBT is the RT is real time. It is supposed to be fully embedded into the plan's formulary and claims and accumulators. So it should have access and be able to produce as accurate a figure as the health plan itself would be able to produce. Can't tell you everything's going to be 100% of the time, but there are RTBTs already out there in the field. There are a number of plans that are offering them ahead of the go live. So hopefully it's getting debugged.
So Michael, do you mean like as a result of this reg, they've already started to put them out? Or was this something going on before that?
That's right. Even with January 1, 2023 being the deadline for offering these to Medicare beneficiaries, there are a number of plans that have gone ahead and brought them online this year.
I see. Okay.
I was thinking the answer was going to be it depends, but I'm cautiously optimistic about it. I think it's much needed. It would be a great change if it works. But we're talking healthcare. Nothing always works perfectly, but
yeah,
I'm looking forward to it.
Well, I agree. I think it could be great. So just for clarity, the thing we're covering, the RTBT, that's for Medicare. But Michael, there's also something that's going to be applying to commercial patients. Do you want to tell us about that?
Sure, happy to do that. So there's a regulation in the commercial market called the Transparency and Coverage Rule. And the Transparency and Coverage Rule has its own requirements around drug cost transparency. And this comes in 2 stages. You'll see the implementation dates are a little bit later than they are in the Medicare market, but stage 1 is 2023, and there will be 500 shoppable services that a plan will need to furnish a self-service price transparency tool to its members. And then in 2024, you can see that that would apply to cost estimates, in-network rates, all covered items and services, including drugs. So in 2024, we'll see the type of transparency that we'll see in Medicare in 2023 coming into the commercial market. The reg is not quite as prescriptive in the RTBT requirements, but if a plan doesn't go all the way to an RTBT tool, there will almost certainly be third-party vendors that offer it to consumers if the plan doesn't go all the way there itself.
Yeah, they'll aggregate and probably pull the information in a comparable way as well, which would be really valuable.
That's right. And it's not hard to imagine that some of these aggregators will even seek to do it across plans and empower consumers to look across plans as well as within their own plan.
Got it. Got it. So Adam, in your time as a pharmacist, you described, yes, people come, they don't know what it's gonna cost. Would you say that was true across the board for Medicare and commercial patients?
Yeah, absolutely. I was guessing that the word prescriptive was used on purpose here. It was thought through, and I see the big money also to go with the big drugs, but no, it goes across all plans. Almost 99% of the time, honestly, when you're at the pharmacy, patients are surprised by their copay because you sign up for your health insurance and you get that 30-page book. That,
yeah.
I mean, it's kind of like the terms of service that when you sign up for your Apple contract that you don't read. I feel like it's the same way. People just don't understand what they're walking into. And we were talking about the patients taking more of the risk as commercial plans continue to grow. And it's becoming more and more evident in commercial plans that they don't know what their medications are going to cost either.
Yeah. So let's kind of think about, and let's just turn now to, what this means for VillageMD and our providers and what, kind of apply this. How will this affect them?
I mean, I see it as the ability to have this conversation. Well, number one, patients are going to come in educated. When the patient tool that they're able to look at this at home and know what medication they may want, you may have a patient who is being diagnosed on a medication for a while. They'll go home, see the commercials that we love to have here in America, where we talk about the drug with the 6,000 side effects that they say really quickly at the end. But your patients might actually run that through and come in and have a real conversation with you about this medication they saw. But mostly I see the reduction in work. Less prior authorizations, less formulary interchanges needed. That means more patients picking up their prescription. They're going to know what it's costs, and then improved adherence again leads to better outcomes of therapy. And I don't want to sound like a broken record saying the same thing, but I'm excited about these conversations starting and being able to save our providers time to be able to take care of their patients and Wendy, I've never talked to a provider who said, I love sending my patient to the pharmacy, not knowing how much they're going to spend.
Right.
Or what nonstop. All I hear is, can you get me a list of what meds are covered on the formulary? What's $0 for our patient? Can you that's the idea behind formulary interchange. Just let the pharmacist give them what they need. You might not even need that anymore because you'll be able to make that decision on site.
Yeah, I was thinking about prior authorization and the interchanges as being just sort of built in with this tool.
Yeah, well, it wouldn't even be necessary if if you're going to have to do the prior authorization when you even send the prescription, because it'll be flagged.
Yeah,
And that kind of even brings another conversation. As we continue to focus on social determinants of health, patients will actually be able to have financial conversations with their providers. Provider might say, I'm going to get you this medication, I'm going to send it over there, it's going to cost me X amount of dollars. You know how many patients show up in the hospital just because they can't afford food or they can't afford their medication?
yeah,
Maybe they'll have that conversation right up front with our providers and say, is there anything less expensive?
yeah. Well, maybe, you can start to encourage patients to do that.
One of my saddest stories as a pharmacist, I remember a patient walked to the counter with a little tub of ice cream, and they came to pick up their medication, and I told them the price of the medication, and they just looked down, put the ice cream to the side, and then bought their medication. And then
Ah,
it's just sad thinking that you can't, it was like $1 for the ice cream, and they were in such a tough financial situation, but knew that they needed to have good healthcare. And I just see this as being one tool to help our providers avoid that situation, and then everyone can have ice cream.
yeah,
Yeah, and of course, Adam's anecdote is spot on, but for a number of people, and particularly people with restricted incomes, it may not be ice cream. It may be a question of nutritious essential food, or turning on the air conditioning in the summer, or something that much more important to a healthy life.
yeah, yeah. It's a good point. Well, we'll just have to watch out and see how, as these become available, how they're working. We have to keep an eye on this, and maybe we'll have you guys back and do a follow-up and see, how it's going.
That would be fun.
Yeah, I'm on board. I might argue that ice cream is essential to some people, but no.
I wasn't going to say that.
I didn't say
but
chocolate. Chocolate might have been a different story,
I
but no,
mean,
completely aligned.
He said nutritious food, and I felt judged. Okay, I'm gonna be honest. But the point's well taken, and I really appreciate having both of you here as experts to take us through this. And like I said, maybe after the first of the year, we'll have you back and just check to see, has this had an impact as it was hoped? So thanks to both of you for joining us today.
Thanks so much.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.